Dr. Mina Shafik. Welcome to the Wellness Butter Show.
Yeah.
So, can you tell me what is neurodivergence?
Neurodivergent is so if you think about like most people are, they have like a functionality of the brain and their neurons. They all go like almost the same kind of identical functions. So this is what we call like a typical functions of the brain and the neurons between each other, so the communication. So someone a neurodivergent, it would be like their brain components or neurons might act differently than the typical structure. Whether it's like, for example, there is extra activity or less activity in the neurons or so on, depending. But then this is not the typical. So someone is a neurotypical, someone is a neurodivergent, diverting from the typical regular thing functionality.
So, what does it mean then when a person is neurodivergent?
So yeah, it means that their brain and or their neurons are communicating differently, not necessarily bad or good, just like differently than the regular or the typical thing. So this is neurodivergent in general.
And ADHD is a type and a term that is thrown around constantly in conversation, on social media, and self description. From a clinical perspective, how has the term changed over the last few years?
Yeah, so ADHD is a neurodivergent, I think, or someone with ADHD we will call a neurodivergent. Along with there are other types, like for example, the common ones: ADHD, autism, and special learning disorders, like dyslexia, dysgraphia, and so on. So ADHD, when it first started, I mean, it was always there, but no one was actually looking at it or seeing it as a an issue in general. So it wasn't recognized. And then when it became recognized, let's say the people like, again, they had the stigma against any mental health in general. And they were probably like getting away from or not trying to identify with it because it's kind of like shameful to have a mental health disorder in general. But obviously over time, as like the stigma for mental health is getting less and less, people started accepting this kind of diagnosis. And if you compare it, even like, what is ADHD is like, in like a couple of words, as a poor attention and hyperactivity. And people would be like okay with that versus, for example, the schizophrenia, like seeing things and hearing things that are not there and so on. So people were more accepting of like, okay, I can have ADHD. And now it is used in a way of, because we are living in a fast paced environment, things a lot are improving and like, advancing in a very fast level. Like if you even compare how we advanced in the last 10 years, is much more than the last 20 years that we are keeping the pace very fast. And that people are like having tons of demands from work, working late hours and doing all of that. So obviously they will start to have like deficiencies or like shortcomings, like whether they didn't pay attention in that task they submitted or they forgot a deadline or so on. So they try to kind of like find an explanation, justification for themselves. Like, why am I not up to the pace as the rest? And because it's not like an odd one out, because most of the people are in the same fast pace. So why am I having shortcomings? So then they start to look for things. And then as like you see, like, inattention, procrastination, all of these as an ADHD. So then they use the term as kind of like a self-explanation. I might have ADHD, I might have an issue, like a mental health thing that is in my body. So ADHD. And it evolves now to even using not just a self explanation, but also like a justification for any shortcomings. If anybody calls me out, like, hey, you know what? I have an ADHD. So, so this is how it evolved from not being recognized at all to a lot of people using it as an excuse and self explanation.
I think it's definitely thrown around so freely nowadays. I know a friend of mine diagnosed me to the point where I actually went and checked with a psychologist if I did have ADHD. I feel like I'm definitely neurodivergent. I need to delve further into it to see what it may be. And again, I'm thinking about this only from a perspective of attention span. That's why what you said made sense because
Yeah.
people are using it as maybe just an excuse or, but what does ADHD actually look like in an adult?
So in terms of symptoms, so it's basically, I know a lot of people like can see it easily, but it's kind of like, okay, poor attention span. So like I can't pay attention to something for like short amount of time. I cannot spend it for a long time. A kind of shifting between multiple things, but like not in a functional way. It's a more messy and I can jumping between topics or jumping between activities. Feeling restless, feeling like hyperactive, like moving a lot. Procrastination, like delaying everything to the last minute and suddenly doing everything like the last minute. Missing details, obviously, and like repercussions of being inattentive, forgetting things, forgetting deadlines, forgetting some information, and so on. It's also the same for child. The only difference, or like the main difference between a child and adult, is the way they present the symptoms. So, someone hyperactive, a child hyperactive, he can like come on the dining table, like jump on it, and so on.
Mm,
Obviously, an adult would not do that because it's
yeah.
kind of like awkward. Yeah. So they wouldn't jump on a dining table, but they would move like, let's say, between rooms a lot or remove a lot. So
Okay.
both are hyperactive. It's just like the way they present their hyperactivity would be different based on obviously the age, the social norm, and so on. And attention, one will not focus on his homework, the one will not focus on his work task, and so on.
Yeah.
These are symptoms, but what actually is interesting is, if anyone is anxious, let's say, they would be inattentive.
Mm-hmm.
If anyone is too depressed, is also would be inattentive if are procrastinating. If so, there is like the symptoms themselves, they can coincide or have like similarities with a lot of other diagnoses. Sometimes not even a diagnosis. Let's say you're working like for the last 3 days, very working late working hours, um, then you're exhausted. So on the fourth day, you are inattentive, which is makes sense. I mean, you're tired.
Of course.
Because
Right.
kind of like this is what some people would miss is kind of like um, the side effects or the consequences of certain lifestyles or situations. It doesn't necessarily mean a diagnosis of ADHD.
Very interesting. Yeah, I didn't know that link between other sort of mental health disorders and ADHD or like neurodivergence in general. I didn't realize that link. But also, of course, when people are burnt out, you are likely to be less attentive. I think that's when people make that correlation and think, oh, it must be ADHD or it must be ADD or, some sort of neurodivergent condition. Is that what it's called? Neurodivergent condition?
Yeah,
Mm-hmm.
or the class main group. So it's neurodivergent, which has like ADHD is one of them. Autism is another one. Again, dyslexia, dysgraphia, special learning disorder is another one. These are like the three main groups. There are others, but the famous ones. So ADHD is called attention deficit hyperactive disorder. ADD, which is attention deficit disorder, they stopped using the term ADD now. It's just like they say ADHD, whether it's inattentive type or hyperactive type or combined. So instead of saying ADD and ADHD, it's like now ADHD, just we will specify the type they will.
Have you seen a rise in any particular one?
I'm seeing a rise in general for the cases, but the rise is also related to the recognition because people would say, okay, back then, I don't know, in the 50s, we didn't have that. Well, no, it wasn't even recognized that back then.
Yeah.
And when it was recognized, people were not even going to a mental health specialists to get diagnosed or anything. So now with the recognition, yes, we are seeing the rise, but that's because it's something new. Whether it's actually more in the population or not, that's still debatable. I mean, some people say, yeah, maybe it's more due to the environment, like, like how with any kind of like other diagnoses like cancer or so on, it's kind of like because of the lifestyle or the food that we eat or so on causes that. But we still can be 100% sure because we need to see like zero and see if someone if he eats certain food or lives certain lifestyle and he gets ADHD, then we say, okay, that's the cause or so on. It's more correlational, basically.
And
You
is
see,
there a huge link between food and ADHD?
yeah, I mean, like there is a lot of things like food. So food, I mean, stomach affects our mental well-being in general, our moods. So obviously, like the food will have an effect, whether is it causing or not, we don't know. It's correlational. Same with environment that I am staying in, the rearing that I had as a child, the genetics, all of these things can have correlational effect, but not necessarily a causation.
Okay. And is it genetic? ADHD?
Yeah, yeah, actually.
Mm-hmm.
So if you look at like the biological level, like between neurons, so usually a neuron, a cell of the brain, is like in another one, they're like connected like that, and there is a gap in between. Now, the information or like the signal in a neuron is an electric one. So obviously, any electric signal in a gap, it will just disappear. It needs to be connected. So what happens is that the neuron will transform this electric signal to chemicals. We call it neurotransmitter, where it's released in that gap. It attaches to the second one, becomes electric, and so on. Okay. Obviously, this happened like in a millisecond or like I don't know if the unit, but like very fast. There are types of neurotransmitters, these chemicals. We heard of some of them like dopamine, acetylcholine, GABA, and serotonin. So we focus, let's say, on dopamine. Each one has like various functions and they can have common functions together. So let's say with dopamine is responsible for learning, being happy, being euphoric, motivation, attentive. So let's say in a neurotypical person, I'm giving random numbers here, but like in a neurotypical person, he releases about, let's say, 10 dopamine per second.
Okay.
Okay. An ADHD one, he would release it, let's say, 2 per second. Okay. So much less. So then the brain knows that this is too little. So it tries to compensate. So it starts to prompt to do things that can produce more dopamine. Let's say, oh, let's jump around. Let's talk about this. Let's remember this argument we had. You know what? How about we learn a new language? And so on. It's try to prompt as much as possible to stimulate more production of dopamine to reach a good level. But obviously, it is doing it like randomly or in a messy way. So to the outside, then the person is like doing many things and being hyperactive and being all over but because people cannot see what's happening exactly in the brain. So then when someone with ADHD goes to, for example, a psychiatry to take medicine, so the medicine is usually a stimulant. So stimulant meaning that the pill will help the neurons to produce more of the neurotransmitters. So these stimulants will produce more, let's say it will help your neuron to produce 8 more dopamine. Compare 2 and plus 8, it becomes 10. So then the brain sees that, okay, I have enough production. I don't need to compensate. So it calms down,
Mm.
which is kind of fun because like people think, okay, someone hyperactive, if I give him a stimulant, is going to be like crazy all over. Yep. But technically he's hyperactive because he's not producing enough. But if I help him with the stimulant, then he's producing enough. So and then he actually calms down. Let's say with someone anxious, not ADHD, but anxious, so inattentive. So let's say, yeah, maybe he's not producing 10 dopamine percent, but he's producing 8, for example. So if I give him a pill, a stimulant, another 8, it's like 16. So he went overboard. So then he's panicky. He's like overly anxious because he didn't have ADHD in the first place. So he kind of had just like He's just like more inattentive because there is a lot on his mind.
Okay.
Does that make sense? Like where we differentiate like someone actually have ADHD or not.
Good.
So something like that's biological, neurological, that's you're technically born with it. So yeah, there is the genetic parts, which is a lot of time, yeah, parent might have the diagnosis or a gene, and then their kids will have or have more likely to be also diagnosed with ADHD.
Okay.
And these things are since you're born, so it has to be present since your childhood. So it's not something that you just gain like there like recently.
Okay.
So this is what prompts our assessments to go further in the history, not just to look at the latest 2 weeks or latest month. It's kind of like, let me look at all of your history here.
Okay. And is there a way where maybe it's not present so much when you're a child, but it becomes a lot more present as an adult?
Yeah, I mean, yeah, and that happens a lot. And why that might happen can be, let's say, when you have a recessive gene, but then it gets activated due to certain factors. So that might be a case, or it might be because also the demands of life, like, I mean, as a child, maybe you had a lot of things like provided to you, but then as an adult, you're independent. So there's like mental workload. So
Yeah.
how to differentiate the two, that's where it goes with a lot of the assessments.
What does a proper clinical assessment look like?
Yeah. So a proper, or let's say like Earth APA, or most like kind of the associations, international associations, when they do like what can like help in diagnosing, you have to put in mind that they are considering many factors, not just like what proves the diagnosis, but also like coverage factors, the time spent, and so on. So they are considering many factors, not just like the diagnosis is done by this or not. So usually, like you would meet, yeah, with a psychiatrist, where they get a lot of history. From their point of view, they can send you then to also a psychologist who gets also background information from the day that your mom was pregnant with you till today. So
Okay.
like extensive one. And then they do like a questionnaire. I give you a questionnaire where you report your own symptoms and as a standardized questionnaire. And they also send a version for observers or others, such as teachers, partners, or so on. Because technically the symptoms should be identified in at least two settings. Okay.
Sorry, I missed that.
Yeah. 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 In two settings. So like work at home or school at home, not just home, not just school or work. Now, this is like technically what's can be accepted, and then you can get like the diagnosis and whatever treatment is required. Now, this is, I wouldn't consider that a kind of like the top standards or like the top procedure because the reporting of the person of their history is subjective, obviously, because the person is, getting things like from their point of view. And obviously, they're getting like some information, especially if you're an adult, getting information about when your mom was pregnant with you. I mean, it's
Yeah.
hard to get that unless, like, was known.
Yeah. I was gonna ask how do they get that? Is it from a medical perspective or just by asking their mother?
But usually they're asking their mother, and if their mother is there, so but even like mothers themselves, like you don't remember like
Of
when
course. Yeah. Especially, yeah, that phase of your life when your brain's fuzzy and
exactly. Yeah.
yeah, it's so
So, but they
funny.
can report, let's say, like if it's a major thing happened or yeah, then yeah, they would remember that. But again, it's the best as the memories can bring. And then the questionnaires themselves, yes, you're reporting your own symptoms. So there is subjectivity here. You can be very neutral or like, yeah, very objective about it as you can, but it's called subjective because you're still reporting things. And then also for others, the idea of like seeing also others is kind of like, okay, if you're saying something, but others are saying different thing, then maybe discrepancy. But if others are confirming what you're saying, then most probably is right. But then again, all of these are subjectivity. So it's kind of going with a sum of subjectivity. I can reach somehow to an objective conclusion of a diagnosis. What we do, like even as psychologists, and this is what we prefer as well, that we add something we call the cognitive testing, which kind of gives more or less more objective way. So the cock testing is to I test, for example, your intelligence, your IQ. Not looking for exactly a number of IQ, but by the component of what makes an IQ, like your verbal intelligence, how you can understand, respond in words, or so on. Your engineering skills, how you can get a shape in your head, rotate it, so on. Your learning or working memory, short-term memory, how it can learn new things, and so on. So this is like IQ, and then I go for tests about executive functions, like the part of the brain responsible for giving attention, sustaining it, multitasking, making decisions, plans. And then I go on memory, like your visual memory, your auditory memory, whether it's immediate or delay. So all of these are done in like small games or trivia questions or so on. So it's kind of like unrelated, like either not reporting anything from your life, you're just like responding to questions or doing some games.
Okay.
Done in a calm environment in a clinic. So kind of like also removing any factors of like noise or people around you. So removing as much factors that can hinder it. And then when you get these results, so the results of these tests, they don't tell you, oh, this person has ADHD. It just gives you scores. Okay, so you're in average or in high average, low average, so on. So then based on these scores with history taking, with questionnaires that you got from the person and others around them. You combine all of that. So, kind of like you have the objective measures, the subjective measures, the whole history, then you can get to a diagnosis. So, this is why I prefer that should be the standard. However, because these tests, like the cognitive one, they take about 4 to 6 hours at least. And you don't do them in one day, but like you can say it's 4 to 6 hours. It's costly, obviously. Yeah. A lot of insurances don't want to cover it. So kind of like, yeah, if we made the cognitive aid has to be there, then a lot of people will not go to or like to mental health and try to be diagnosed with this. So kind of like to find a middle ground. This is why like they say, okay, you know what you can do with the questionnaires and yeah, good intake, background intake, and then we can do the diagnosis. So kind of this is why like we were figuring out also a way that considers the time, the money, the everything.
Yeah. But does that give you a correct diagnosis as well?
So yeah, usually like I mean, even when you do like the simple ones, if someone is kind of obvious, but it's kind of like yeah, it does get correct because kind of like even other the cognitive test, you would just confirm it more. But
Okay.
when
Yeah.
it's a bit vague, this is where these tests will be much helpful because then kind of like show the differences. And it's instead of it's just like it's not only like, oh, you're ADHD or not, it can also help in like, you know what, you're not ADHD, but you have anxiety or you have different things. So it kind of like also helps actually specify the diagnosis rather than yes or no for ADHD.
Exactly. Yeah. That makes sense. I did a quiz over here actually, but it was just a simple online quiz. So I really feel like I do need a proper diagnosis because the symptoms are there. But again, this is a self-diagnosis. I just think, yeah, there's so much going on in my head. I jump topics all the time. So yeah.
And a lot of like psychiatrists, for example, when they do just the intake and questionnaire, and they see like the person cannot do the testing itself for whatever reason, like non-cognitive tests. So then they will try do something like a trial and error, where okay, we give you a trial like just to try the medicine itself. If you got like really bad, it got really worse. Probably weren't ADHD. If you actually got much better, then you were ADHD. So it's kind of this is one of
Right.
medium ways, yeah, of handling it. It's not
Okay.
ideal, but it's what you gotta do sometimes.
Yeah. Interesting. And are people always willing to take medication right away?
Not everyone, some yes. Kids, like for example, like parents usually don't want their kids to be on medicine, psychiatric medicine. Even me, I understand that position in terms of things. Adults and adolescents, yeah, it depends on the person themselves. Because this is a medicine, a stimulant medicine, so you probably may have heard the name methamphetamine or amphetamine. These are the chemical compounds. So methamphetamine and amphetamine is like methamphetamine meth, basically.
Okay.
So some people want to get diagnosed to get that medicine. So because it's kind of like an addiction thing or like a another substance abuse. So it can be appealing to people, certain people, to have the medicine because they want the drug itself. And obviously, the kind of like, let's say, I say the mystical stories or the urban legends of, this is like super mental. Like if you get the Adderall, you're gonna be like excelling in your exams and so on. So I want that pill. So kind of all these legends, a lot of, for example, college students have a lot of abuse and alcohol or ADHD medication because they give it to each other and they trade in it and deal with it. Because, yeah, students, college students especially, they have a lot of deadlines, a lot of things. So they all side with super pill.
Interesting. And then what are the sort of implications with that? Because now they're taking these pills. Yeah, they haven't been diagnosed or prescribed these pills. So,
Yeah, if you're not ADHD, it's gonna give you like extra boost when you don't need it, which will not make you necessarily focus. It will make you maybe panicky or overthinking. So it's actually gonna make things worse. That
okay.
happens. Obviously, if you take over the dose or you don't take the right dose for you, then it's a stimulant. So it makes your heart palpitation, like heart beats fast, like your blood pressure goes up. If you have a blood pressure problems, usually we don't give psychiatrists won't give stimulants because that can cause death. Like it's just a lot of repercussions for taking the wrong medicine or the wrong dose.
Mm.
So it's always like good to be with a professional to like tell you that, not to kind of, it's not like just being like a punitive, it's just being like, safety wise.
Yeah, makes sense. Obviously, if it's, especially if it could be fatal. Yeah,
Yeah.
makes sense. But then again, like when you're in university and you're not thinking all of these things, you know?
Yeah. You think of it then. I want to pass it.
Yeah, exactly. Exam, and then you realize by watching videos online that you probably have ADHD and this will help.
I can see, I see like
Great.
a lot of the current generation, like a lot of people use it as an excuse for behavior, certain behavior. Can see when someone's again it says explanation, but then when you use it as an excuse over and like, why didn't you turn up to work on time or so? Well, I have ADHD. It's kind of like become the anger for anything, but that's not helpful because
Yeah,
first of all, that creates a bad reputation also for people who actually have ADHD and they don't need that to be put on them. And two is kind of like even with ADHD, people with ADHD, they do can come on time and they do things on time still. But this is the other part of treatments. Psychiatry or like medication, it's kind of like, okay, it helps in I give you the dopamine, I give you the attention, but I don't tell you, the pill doesn't tell you where the attention goes. So you have the energy to be attentive, but you can be attentive on TikTok rather than on your task. So how to manage that attention, that energy correctly, this is where the therapy part comes in, where you learn more about daily skills, things like how to organize your day, how to organize the task, how to break it down, how to, for example, like people come late, like how about we add a buffer, like a 10-minute buffer. So these skills, a lot of ADHD, they do it like when they learn it and they do it properly, big, so then they can still accommodate and be on time, be on the task and so on. So it's kind of like not helpful when someone just uses the ADHD as an excuse for their shortcomings rather than, okay, what are you doing about it?
exactly. Yeah, because then you're also just not taking responsibility. And yes, of course, it is, yeah, awful for people who do have it as well, because then you're just painting them in a really bad light.
Yeah.
So then people who have ADHD, do they have to also go into therapy? Are most of them also in therapy?
Yeah, well, I mean, it's recommended to always do both and just not rely on the medication because the medication, yeah, will give you the energy and the attention. But then over time, if you don't know how to manage it properly, then it's kind of like your body accommodates to doing things improperly with the medication, It's kind of
Okay,
like,
yeah.
yeah. So to
Mm.
try to use the best of it, try to do the skills, learn the skills while the medication helps you achieve that easier. So it easily can be also in levels like moderate, severe, mild. So some people with mild ADHD, they don't necessarily need their medication. They can just do with the skills. So a lot of people, especially who are reluctant to taking medicine, they focus more on the daily skills and everything. So then, yeah, everything improve. They don't feel like I need to have this pill.
Mm, okay. What else do they learn in therapy? I'm just intrigued now.
Yeah, yeah, like your brain is struggling in producing dopamine is doing this, so you kind of like ease in the struggle a little bit. So when you, let's say, you divide your space, you have even at home, like you have this area. This is for working area, station. This space is for cooking. This space is just for watching TV and so on. So the moment you get, let's say, in the bedroom, like where I'm gonna sleep and I don't work on the bed or I do anything. I'm just there to sleep. So when you get into the bedroom, your brain, okay, this is the place where we are gonna sleep. So it starts to wind down and you start to feel sleepy. Rather than you do everything on bed, so then your brain is kind of confused, like, what are we doing right now? Are we studying? Are we working? Are we sleeping? So
Yeah.
organizing the space, for example, around you and make each area like a one function or maximum two functions that helps the brain to accommodate and shift between tasks easier, so you kind of make it easy for the brain. Another one, common one, which is we call it the Pomodoro technique,
Mm-hmm.
which is
That's
like,
fine.
yeah, technically your brain, even a neurotypical, cannot give attention to one task, solely attention to one task uninterrupted for more between 20 to 30 minutes maximum.
Mm-hmm. Okay.
So, neurotypical, if they focus on something, they have 20 to 30 minutes. What happens is their brain would think about something else for a second and then come back.
Mm-hmm.
So, this is what happens. So, that's why maybe someone would stay an hour on something, but technically he spent like intervals, let's say 20 minutes, thought of something, came back 20 minutes, and so on. Now, with an ADHD person, the problem is like, let's say they spent 15 minutes. First of all, they cannot do maybe 20. They can only do 15 or 10. And then when they went to think about something, they couldn't come back. They got lost in that other thing. So they got distracted. So this is the easily distractible symptom comes.
Mm.
So what we suggest is like kind of like, okay, what about if you do with a timer really and like a sound timer that you do 20 minutes and you take 5 minutes break. 20 minutes, 5 minutes. You sit on something, you do fully 20 minutes, you're gonna hear the timer, take a 5 minutes only break, not an hour, just 5 minutes. You'll hear the timer again to another 20, and then you can do like be attentive actually to the task and maybe finish it while you're doing this interpret. This
Mhm.
is kind of like instead of relying on the brain to do the shifts and come back on its own because it's struggling. So then let's do it from the outside. It will help the brain to accommodate.
Interesting. I've never actually tried the Pomodoro method. It does sound very effective. I'm going to, yeah, because I switch between tasks a lot. And then sometimes I'm like, why am I here? What was I doing again?
Yeah.
So, a common pattern is someone self diagnoses themselves with ADHD and then they start identifying with this. And then they come in for a test and realize that it's not what they have. What exactly is happening then? And what's at stake when this happens?
The symptoms of ADHD can be comorbidities with other diagnoses. So, for example, also autism and ADHD have a lot of common symptoms, but there's just like a different mechanism of what happens biologically that is causing the symptoms. So, in these tests and so on, then if it kind of like helps decipher that, like, oh, maybe you're actually on the autism spectrum rather than on the on ADHD, and you can have both still. Like some people have,
Okay. Okay.
but while we like, okay, maybe you're, let's say, on the autism spectrum rather than ADHD. It depends on the person of how, like, if they ever like kind of self-diagnosed and full-heartedly thought about it and like identify with it, or they were just like guessing and came to the doctor. So the doctor, once they made a difference, they accepted it. When some I've seen that a lot, even with clients I worked with, where yeah, they came for ADHD assessment. It didn't turn out to be a neurodivergent. It didn't turn out to be, let's say, autism or something, but it turned out to be, for example, anxiety or a different type of diagnosis. Some of them were resistant to the idea because, again, like they, as you said, like they identify with it. Like it's kind of part of my identity. They're telling me, oh, that I was the lying, or if it was a lie. I'm like, but no, like you take it in a little bit to try to understand where they're coming from. I explain to them like, look, you have the symptoms. We cannot deny that you don't have the symptoms. No, you do, but then it doesn't necessarily mean bad diagnosis. So I cannot say no, you're actually attentive. No, you are inattentive. I believe that. But is it due to ADHD, or is it due because you have a lot on your mind, so you're anxious about it? And this is telling you like it's more with anxiety here rather than with ADHD. So we're not calling anyone like a liar or like you're saying fake things. No, we believe you, but just the explanation, the rationale can be different.
Yeah.
People also have to recognize that ADHD, until today at least, is like diabetes, high blood pressure, or so on. Like these are life terms diagnoses. So kind of like you, if you're ADHD, you're always gonna be ADHD until maybe in the future they will find something. But as of now, it's all your life. So do you really want to be like with a
Yeah.
diagnosis like a terminal, like a lifetime diagnosis? Anxiety doesn't have to be like a lifetime, or depression. So kind of like to maybe look at the optimism here of like, hey, we can recover from anxiety rather than you always have to manage ADHD all your life.
Yeah.
That's another approach to it.
I never thought of it like that. And when people have ADHD and if they're on medication, do they usually have to take medication for the rest of their life as well?
Well, depends on the person. Usually, also because again, it's a stimulant, so it really increases your high blood pressure. So I know a lot of psychiatrists they stopped giving medication to people like when they reach 50 or 50 something, just kind of like for the safety, their safety. So you're more susceptible to blood pressure problems, even with yeah, as aging goes. Then they would probably stop giving it to you. How to manage, given that, let's say you manage your most of your life with learning skills and so on, so then you will be able to handle it. And especially as older people, like when you retire and so on, so like you have way less demands from a you
Yeah.
say given in ideal scenario. So kind of like you might not need that extra energy. Like you just need some attention for some of your daily tasks. But you don't need that much force because you don't have a lot of tasks on you.
Yeah. Something I've thought about as well is in children, because some of them are then taking medication from a very young age. Do they continue their adult life?
Yeah, so depending on the again, like let's say mild, moderate, severe. So someone severe ADHD, like even if they learn the skill, they still need something. They still need the help. So they will take it. They might
Okay.
be able to have to take it, but how long does it stay with them? Like we can up to adulthood, maybe they will stop because again, it's about the demands. Like a lot of times, okay, it is helping me function because if I don't function, I'm in trouble or I am in
Yeah.
danger. So maybe I need, but then when I'm like an older adult, I don't need that type of function to, to be good or to be well. then maybe I don't need that uh, force or energy or extra thing. So depends on how I'm functioning currently, how is it affecting my daily life, and if putting that will help me rather than staying like this or not. If it will help, then I keep on going. Once it stops to help or like reduce the level of help, then I don't need to stop.
Okay. Yeah. And are there any side effects of taking medication? Yeah.
I mean, depending on the type or like the actual medication itself, because there are like so there's methylphenidate, there's amphetamine. So the to say the brand names Concerta, Ritalin, Adderall, Vyvanse, and all these. So each one obviously has its kind of like side effects. I would say the common ones, common use is kind of so stimulation. So a lot of people would have obviously fast heartbeats, high blood pressure. It starts to rise, not like the illness, but it just like the blood pressure
Yeah.
is
In general.
getting higher. Side effects of, for example, like maybe I can be overthinking a bit. It can also feel with like something like Ritalin and the fast release and Adderall, like the fast release tablets, they do like a high. So where you suddenly getting like all the energy, you feel like euphoric, you feel happy, you feel like a thing. And then once the medicine effect starts to go down, then you crash. So the crash suddenly that a lot of people don't like it because then you feel sleepy, you feel moody, you feel like, it's just like you're going down. These are common side effects. The extended one, like where it stays longer hours, they don't do give you the high effect suddenly. It gives you like gradually. But then some people might complain about like it doesn't go away that much, like or like it stays with them. Let's say for so they have problem or light sleeping. Let's say
Mm-hmm. Okay.
less eating. That's another.
Less eating. Okay, yeah. I've heard of these symptoms too. Friends are also increasingly recognizing these patterns in their children when it comes to learning disabilities and sensory sensitivities. What's the right framework for parents then who realize that their child might be neurodivergent?
Yeah, so especially for parents, we tell them to do the assessment. And when you look at the assessment, the full assessment, even with the cognitive testing, there are usually like kind of three benefits to it. One is self peaceful mind, or the peace kind of like okay, sorry, peace of mind. Yeah, that's the word.
Yeah.
Yeah, I know what I have. So that's one benefit. The second benefit, if a psychiatrist doesn't want to give you the medicine until you do this, so then the medication. The third thing is accommodation, like at school, and this we usually see it in school. Like if you need, like for example, accommodations and like extra time in tests, sitting in certain class or environment and so on. So for the school to provide these accommodations, then they need a full assessment.
Okay.
With an adult, usually work would not ask for that or would not even provide the accommodation in a way.
Yeah.
So it's kind of like, yeah, when an adult asking for a full assessment and I tell them like, okay, there are three benefits, these ones. Is there anything that you want? So if they don't want any of these benefits, kind of like, what's the point of going through this extensive tests and costly one?
Yeah.
For kids, because they are in school and because schools usually require that if they want to give accommodations to the child. So a lot of the parents, okay, if you notice that with your kid, take them to, yes, to professionals to get diagnosed, to get to do this full assessment as well. Because then, and also in this full assessment, we're not just about you have ADHD or not, it's also we're looking again at the IQ, memory, and so on. So when we put recommendations, we tailor the recommendation based on their cognitive function. So if some kid is like better learning things verbally rather than seeing pictures, so then I put that in the community, like, okay, give the instruction verbally, um, write it rather than giving it in pictures, for example. So like these tailor things. So then this is in a way to give the best way accommodating, not only in school, at home, in school, everyday life,
Mm-hmm.
based on how they function. And as a parent, you would want that for your kid.
Of course, yeah. It's been a while since I've been in school in the UAE and a lot has changed. So are they quite accommodating when it comes to learning disability difficulties?
Well, both law, they should.
They should be,
Okay.
yeah.
Yeah.
Yeah. I know here
Oh,
in Amsterdam there are sort of things in place for in every school, and it's a public system here, but in every school there's something in place for children who need more time or just have special learning abilities.
they buy, yeah, and you like they're adopting more on the law level uh to enforce that. It's still progress in many ways. Some schools do have great accommodation, some schools don't.
How can a school properly accommodate these learning disabilities?
So it depends on like what exactly the disability. So again, it's if it's ADHD and so on. It's not only about like okay, give you extra time and tests. It's about how I give you the information, how I give you manage the time. How, for example, something for an ADHD child, for example, instead of calling their name, let's say, so Nicola, Nicola, you're ADHD. You're probably in your head. You're not even like paying attention to what's called. So I would say Nicole, and then maybe I would shout like Nicola. That's when you pay attention. But then, yeah, as a teacher, I had to scream. You got like disturbed because suddenly you're hearing screams. So it's kind of like disruptive. So then we say, okay, when you want to call the student, go tap lightly on their shoulder rather than call their name from afar. That will get their attention without causing a lot of disturbance.
Yeah.
So these small things, there when I write a full report after all these testings, I put these in details. So kind of like properly accommodating is following these accommodations to the best you can, rather than just like, okay, give them more time in tests and then the rest stays the same. It's not necessarily helpful here.
And are schools quite receptive, do you think, nowadays?
Yeah, so like when they do, if they don't have like the mental health person in school, yeah, so they come for them for the clinic. We do the assessment, give the report. So the parents would go to the school and give them the report. Like this is what's recommended. And usually, if a school already has a system in mind or like system already in place from let's say previous times, that was just implemented. If they wanna do it from the report, they do it based if they never done it before. And, they adapt accordingly. Or if they ignore it, which happens, they will then also ignore it. But like technically, yes, they should just follow the reports.
And yeah, you just for someone who recognizes themselves in what we've just discussed, how would you suggest they proceed?
Yeah, if they can go to a specialist, psychiatrist or psychologist, and to like kind of like ask for the diagnosis to do the proper assessment, even if they don't have to do the cognitive, but like I mean like to actually get assessed by a professional rather than self-diagnosis. To at least even if you don't want to take medicine, you don't have to take medicine. Even if the doctor prescribe you the medicine, don't have to actually take it. You have a
Yeah.
prescription. Yeah, so it's kind of like you're still free on doing things, but just for you to also know for yourself, like what diagnosis will help. And the reason, and this is, I would say this in general for mental health. What's the point of giving diagnosis? For at least mental health specialists, we don't give diagnosis to kind of label people or to shame them or to put them in a box. It's to because we have a lot of treatment plans in our heads. So kind of like to filter it down, we use the diagnosis to kind of like, okay, it's ADHD. So I would filter from the 100 treatment plans I have in my head. But when someone from not a mental health specialist, what's the point of giving or calling someone or calling yourself with a diagnosis? Are you filtering down treatment plan or trying to find a treatment plan basically? Or what? Or is just more of a label you want to kind of just to use it as an excuse or a label on others, you want to judge them and so on, then this is kind of like the diagnosis doesn't help. There's no point of doing this. So this is a goes not just ADHD, it's ADHD, narcissism, all of that kind of like thrown out diagnosis here and there. It's kind of like, why calling someone narcissist? Are you gonna treat him? Like, are you developing treatment plan, like there's no point to stop from refraining that. So if you wanna you see this, identify yourself, you're not sure, you wanna go with the know what kind of treatment plan, then go to a specialist, see if you have the diagnosis, and they will provide you the treatment accordingly. And even not ADHD, it can be anything else, but also you have tailored treatment plan for that other diagnosis if you get another diagnosis.
Mm-hmm. Yeah, makes sense. Okay.
Yeah.
We end every interview with the question, what's your wellness butter recipe? So, Dr. Mina, could you please tell us what is your wellness butter recipe?
A lot of people, I tell them to receive things from their senses. So, meaning that when you think or you wanted to make a to do list or write your thoughts or so on, or put your thoughts out, use your senses. Or kind of like, if I want to express myself, let me write it because then I can see it. So, it's coming from my vision sense. The reason for that is because anything that comes through your senses gets recorded better in your brain. You actually to record. This is like an attention thing. So you actually pay proper attention to it, and it gets saved better. So rather than thinking about the task, write it down. So when you see it, it gets recorded and memorized better than I just thought about it. It gets lost between the thoughts because you're thinking too fast and too many thoughts at the same time. If you record yourself and you hear yourself, so it's from your hearing and so on. So you like put things through your senses better than just thinking about it. That gets proper recording and recalling later.
Okay, lovely.
So yeah, as I have, it's my ritual having like a light breakfast, always having something light to start the day with. Then going to work, working basically. So my shift is like usually from 11 to 8. So it's a kind of a lot of working hours, and going back home. Uh, I'm tired, yeah, and I just have like a dinner, and I usually like kind of wind down. This is just because of the type of work I do. Like I hear a lot of people, I hear a lot of problems. So kind of like at night, I just want to like diffuse a bit.
Yeah,
So
decompress.
yeah, so it's just like play thing, like play maybe watch TV or something, but I'm
Okay.
paying attention, just like having like kind of like this white noise from TVs,
Yeah.
like trying to wind down, and then
Yeah.
once I'm relaxed, then I go to sleep. And yeah, this is
Nice.
a typical day.
Okay. Once you're in the bedroom to unwind and really like relax your mind, do you have anything in place for that?
Yeah, it's one of the things like dividing the spaces. My bedroom is for sleep. Uh, it's not for reading. It's not for social media. It's not for anything else. It's for sleep. So literally, if I feel sleepy, I just go to the bedroom. The lights are off, and I would just try to sleep. If I am a bit, let's say, like not sleeping after like 20 minutes, I don't force myself to, oh, I have to go to sleep because that increases anxiety. That's what make me not sleep actually. So what I do is like I go out of the room, do something like a boring activity. I call it. It's just kind of nothing stimulating, just like something very boring until I feel sleepy again. Then I go back again to bed. I can repeat this multiple times until I go to bed because even the repetition will exhaust me in general.
Mhm.
So
Okay.
it will make
What's
me
a boring activity? I'm intrigued.
puzzle reading something like kind of a non-stimulating, like kind of boring thing, like boring fact, trivia facts, just like anything that is not necessarily stimulating. Whether like I would watch maybe a documentary about animals, something. I try to avoid screens in general, but
Skip.
yeah. But if I had to, like, then maybe do it like in life, but preferably readings about something, the reading itself, but not to read like a scary story or like a suspense, and then nothing stimulating, just like kind of facts, Wikipedia or like encyclopedia. And doing like activities like knitting, if you do like things that's, any kind of like handcrafts, like it doesn't necessarily need a lot of mental input or, outputs from you, then yeah, just these are the boring activities.
Okay, lovely. Well, they don't sound very boring. Well, thank you so much, Dr. Mina. That was a lovely chat. I'm glad I learned so much from you.